Hi, my name is McKenna. I'll be your student nurse for today. Can I get your last name and date of birth?
Aronowitz, August 18th, 2000.
Alright, and can you tell me the date today and where we are?
Yep, today's day is September 27th, 2020, and we are in our apartment.
Okay, and do you have any food, drug, or environmental allergies that you know of?
Nope, no allergies.
Alright, well now I'll wash my hands and put on gloves before performing the assessment of your heart rate and respiratory rate. First, I will take the radial pulse and determine if it's irregular or regular. Alright, it is regular, and now I'll take a stopwatch for 30 seconds and I will count her pulse. Alright, and now I counted 53, and multiplying that by 2, it would be 106 for a heart rate. And now I will pretend to still take her pulse while watching her chest for rises and falls, so it's not affected. And I counted 8, so multiplying that by 2 would be 16 respiratory rates. And now I will inspect the patient overall and look at her posture and her position, which both appear to be normal and relaxed, and she doesn't appear to be in any distress. And then I will start to look at her jugular veins for any distension, which don't appear to be distended at all, so that's good. And now I will inspect and palpate the carotid arteries. So, and now I will auscultate the carotid arteries. The grade was at about a 2, so that's good. And now I will look at the precordium, chest area, and I will inspect and palpate the apical pulse. I will be feeling for any heaves or thrills as well, which I do not appear to be finding, which is good. And now I will begin to auscultate the heart with the diaphragm of my stethoscope. First, I will start out with the aortic, and then the pulmonic, and then the Erb's point, and the tricuspid, and the mitral. And now I'll switch my stethoscope to the bell and repeat. All right. That appears to be in good order. And now I will begin to inspect the legs and feet. Look for any edema. So doesn't appear to be any in the foot. The grading, the skin bounces back up, so it would be a 0 grade. And now I will look for the dorsalis pedis pulse point. Okay, with a grade of about 2. And now I will look for the posterior tibial pulse. Normally I wouldn't be doing this through clothes, but for the convenience, graded about 2. And now I will feel for the popliteal pulse under the knee. Graded at 2. And now I'll inspect her hands and nails, which both appear to be in good condition. And I will check for the capillary refill by pressing on her nail beds. And it refills in about 2 seconds. And now I'll check her radial and ulnar pulse. Actually, rest one. And alright, and I was able to find them, and they're graded at about 2. I believe that is it. So do you have any questions or concerns?
Nope.
Alright, thank you.
Mm-hmm.